What if the biggest barrier to getting better isn't your diagnosis, but navigating the system itself? Welcome to the Practice Pulse, where we explore how healthcare and wellness leaders are building smarter systems, creating better patient outcomes, and scaling their impact. I'm your host, Nancy Margrit, founder of Optima Pro AI, where we help healthcare and wellness businesses grow through practical AI solutions and systems and operational infrastructure while retaining the human touch. Today's conversation is one I've been especially excited about because we're diving into a space that most practitioners don't fully understand, but their patients desperately need. I'm joined by Emily Bernstein, founder of Wheelhouse Health Navigation, a board-certified patient advocate who has helped clients eliminate over 1.2 million in medical debt while guiding them through one of the most complex systems out there, the healthcare system itself. This is a conversation about access, advocacy, and what really happens behind the scenes when patients try to navigate care on their own. Emily, welcome to the show.
Thanks so much, Nancy. It's great to be here. And we're
Awesome.
up to 1.3 million now.
Okay. All right. Just moving numbers since the last call we had. Okay. Well, cool. And let's just start at the beginning. Can you just walk us through your journey into patient advocacy and what led you to build Wheelhouse Health Navigation?
Absolutely. So I actually have no medical background. So I was my mom's primary caregiver as she went through a diagnosis of brain cancer. So it was a lymphoma primary to the brain, the nervous system. So it involved several chemo treatments and rehab in between. And then she also got a stem cell transplant in 2020 when there was a pandemic going on. So yeah, so lots of dynamics to navigate. So, going through that process with her, also having been a patient I'm quite accident prone. So I've been a patient myself several times. And going through that, you just realize how difficult it is to navigate the process while you're also a patient. And even the caregivers that are alongside you, there's so much to pay attention to. There's so many logistics that are going on, and really important dynamics that you have to pay attention to in order to get the care you need. But it's really, really difficult to do that while you're recovering or you're focusing on a new diagnosis or, changing your entire diet or whatever you have to do to get well. That you really, when you're tasked with also navigating prior authorizations or insurance denials or gigantic bills that you have no inkling of how to pay. All of that is just incredibly difficult to navigate. Seeing that firsthand with my mom, my background is actually I've done a lot of customer service and I have a master's in international education. So I've worked with people from all over the world and many different backgrounds, and thinking through that lens, being someone who is unfamiliar with our healthcare system. People who have been here their entire lives don't understand it, let alone if you just came from somewhere else as an immigrant or don't speak the language or don't know how to get around your new city, those kinds of things. So that is why I founded my company, to provide that navigation assistance and really help people hold their hand while they're going through this process so that they can focus on the being healthy part of healthcare and not the how much does it cost, all of the anxiety, the stress, the lack of transparency, and all of those really, really scary and life-changing things that can be going on sort of in the background while you're getting treatment.
Wow. Yeah. One of the things that stands out to me a lot on this podcast is how there's often this innovation in healthcare that really is born out of someone recognizing the gap and then filling it with their own personal skills. Like you're taking
Yes.
your education background and how you can really guide people through a system and using that for good, and an experience that you had that was, it sounds like, pretty complex to navigate.
Yes.
So when you identified that gap, tell me a little bit about what was the biggest gap that you saw in the healthcare system and what made you realize that patients really needed this level of support?
Sure. So again, as a patient myself, I've had huge bills that I knew I shouldn't have to pay. I think that a lot of this comes from people who want to fight on the principle of it.
Mm.
Like, I think the statistics is that over 80% of medical bills have some error in it. And so you may
Wow.
be getting billed exponentially higher than you should be paid. A lot of people don't even question it. They just pay the bill. And so for those people out there who know that it's wrong, know that they shouldn't owe this much money, and they want to demand that accountability, I think that that's how I approach it. And I think
Hmm.
there's enough people out there like me that this is a sustainable business practice, because a lot of people, they look at their bill or they look at their explanation of benefits and they say, "Why are you charging me this much? I pay for my insurance. Why isn't it covered?" And they have some sort of question, but then they have no idea where to go next. So like so many people have absolutely no understanding, completely understandably, because they make it very opaque on purpose, but there is so much to know about navigating the back end of those bills and getting the corrected amounts so that you're being charged fairly for the coverage that you've received instead of these exponentially higher amounts.
Yeah,
So
and like
I think that's a huge gap. Yeah, people just don't know where to start.
yeah, and like you said, it's, they're trying to navigate and manage logistics and finances and care decisions all while trying to heal or care for another. And then on top of that, you've got an 80% error rate. That's huge, where
Exactly.
you could go ahead and really recoup some of that really can be a big life-changing amount of money for some people.
Sometimes, yeah, exactly. Like even $2,000 can be life changing to some
Yeah,
people. And so getting that covered through any means necessary, there are a lot of options. So I always say to people, don't pay the first bill. It's probably wrong. Let's figure this out.
that's great advice. So who is your ideal client at Wheelhouse Health Navigation, and what are they typically struggling with when they first come to you?
Yeah, great question. So, most of the people that reach out to me are actually a caregiver or somebody kind of related to the actual case that's going on, but not the actual patient themselves. So, I work with a lot of family members, friends of the family, really concerned friends, that kind of thing. And then most of the cases that I work on are specifically related to higher bills that people can't pay. A lot of people have an overwhelming number of bills as well. That
Mm,
a lot of people come to me and they're like, "I have this stack of paper and I don't know what to do with it." And so I go through that systematically. We reduce what we can, that kind of thing. And then there's also a lot of people who get out of network care and they're trying to get that covered in some way, shape, or form. High volume or high dollar amount are the systems that are the situations that I work with. So, and then that person can be anyone really. So, anyone that has just gotten a new diagnosis or had some sort of trauma, unfortunately, that they've had to go through, any of those people are potentially eligible for a reduction in the amount that they owe.
okay. And then, so let's talk a little bit about how you actually support your clients. Like, what does the process look like when someone engages with Wheelhouse?
Sure, sure. So I work all remotely, so I can work with people from all over the country. I've saved bills for people in, Montana to Florida to California to all over. So I will do a call usually and explain my process. And then I send out a little here's what to expect documents. And once they approve the proposal, then we go forward. There's usually a bit of homework up front for the client. So they provide whatever documents they're working on. So the itemized bill, the explanations of benefits, any correspondence they've had with the providers, that kind of thing. And then we do have to do the process of getting authorized. So I actually get authorized as a representative for your providers, and that allows me to speak with them in detail on your accounts. So say you've got physical therapy out of network that you're trying to get reimbursed, I would get authorized with your insurance, with the physical therapist, potentially with the referring provider, whatever it might be. And then I can actually act as your representative. And so I fully step into the role of negotiator for you. So I take everything off your shoulders. So that allows you to focus on the treatment, the recovery, like I said, the actual well
Hmm.
being part of our healthcare system. So it's really all encompassing, it's full service. And I take all of that hold time off of your shoulders, waiting on hold to talk to hospitals and
Yeah.
providers, um, and and navigating, asking all the questions, navigating all of those back end procedures so that you don't have to worry about it.
That's awesome. Yeah, what I like about your model though is that it's not just reactive. It's not like you're just reaching out and taking care of the one thing. It sounds like when there's a diagnosis, you can really step in and be
Yeah.
proactive in a structured, strategic, very personalized way.
Very
which
true.
is it could be life changing for someone that's gone through, like you said, a serious trauma or a major diagnosis so that they're really able to focus on healing.
That's true. And there are resources available through hospitals sometimes. Like you may be able to get a patient advocate through your provider.
Mhm.
So that's one option that a lot of people have tried before they come to me. They aren't able to actually cross lines and appeal denials from within the systems that they're working in. So those kinds of things are still out of reach for any internal providers, those kinds of things. So that's a difference between me and an advocate that you are able to get from the hospital or your insurance, that kind of thing.
That's a great distinction because you can really step in much further into the role and really lift a lot more off of people's shoulders so that
Exactly.
they're not bogged down by all of that
Yeah. And I
paperwork
can
and
go up
legwork.
against a policy that your internal advocate may be
Mm,
required to uphold, those
right.
kinds of
Yeah.
things.
You have an actual advocate on your side, not one that's being paid by the person you might be or the
Precisely. I'm
entity you might be
actually working
advocating
for
against.
you. I'm working for you, not the hospital system.
That is a
Exactly.
really good point. And you've worked across billing, authorizations, and care logistics. So what do most people misunderstand about navigating healthcare from a financial and administrative standpoint?
I think the biggest misconception is that you can say no. There's a lot of people there there's people on either extremes. So there's a lot of people who think that they get a bill and they're, terrified of going to collections. They're terrified of waiting at all so they just pay it out of kind of terror. And then there's the
Mhm.
people that think, oh, if I just ignore this, it'll go away. So there's a lot of people on kind of both ends of that spectrum.
Yeah.
Whereas a lot of times, again, you don't have to pay the amount that's on that initial bill. You should really analyze it thoroughly and make sure it's accurate before you pay it. And then if you're not able to pay it, ignoring it won't do anything. So you need to have some concrete strategies
Mm.
to get that number lowered or find a manageable way to actually pay for the bill that will be still, not damaging to your credit score or uh, having them come after you.
Right. Yeah, because nobody wants that.
Exactly.
Yeah. There's a huge difference too between receiving care and successfully accessing care, and that gap is where your work lives, really. So share with us an example of a client transformation that really highlights the impact of your work.
Sure. Yeah. It's the best part of my work for sure when you get to call a client and say, "Oh, guess what? Your bill is now zero." So that's really satisfying.
Yeah.
I have just the other day, there was a case where a woman had switched insurance at the beginning of the year, and her medication that she'd been taking for 15 years was no longer covered. And so I worked with her prescribing physician, a pain specialist that she is working with. We worked with the insurance to find a comparable medication that would be covered by the insurance, worked with the prescriber to submit that prescription, worked with the pharmacy to fill and get all the authorizations that were required. And she was able to fill it after, I think she went without her medication for 3 months because
Oh
she
my
had no
goodness.
idea how to navigate all of these steps on her own. So, when I got to call her and say, you can go pick it up tomorrow, it was quite satisfying.
Yeah, that is great.
Yeah,
That's wonderful that you're able to help people really get the care that they need. So you've built Wheelhouse Health Navigation into a functioning business. It's not just a service. What systems or workflows have been critical in allowing you to operate effectively?
great question. I use Google Business for all of my online activities. So
Mhm.
Google Drive, and that is all, it's encrypted to the level that I'm basically required. Yeah, everything is encrypted, not to HIPAA standards because they're pretty explicit, but everything is encrypted. So information is protected. And that is a big concern of a lot of people. So I make sure that
Mhm.
everything is very private. So I use HubSpot for my CRM.
Okay.
So all of my clients are in HubSpot, and I have different platforms that I use for various aspects of the business. So I use Wave Financial Advisors for all of my accounting, and it's free and it's wonderful. I use a time tracker called Clockify, and I do use. So I know that you're focused on AI, and there's a lot of talk about how AI can come into this space and help out. And I will say I'm a little bit of a Luddite when it comes to using AI because I just don't the hospitals are such dinosaurs with their technology that I
Hmm.
think until they catch up, it won't do anything to use AI or to try and automate the process of, appealing, following up, etc. There are certain aspects of the work that I would love to automate, but I don't think that exists out there. And so I do use though some AI systems to like analyze a summary of benefits, for example,
Mm.
for insurance. Is this covered? I can upload the whole 104-page document and it will spit out an answer for me, which is really nice. So I hope that answers your question. Is that
No,
what
it
you're?
answers my question perfectly, and I agree with you. Like, AI is especially in the what you think is, like, the easiest area in the, like, insurance and the paperwork kind of area. I feel like the healthcare is so far behind, but I just went to a healthcare summit last month here in Kentucky where I live, and it was, healthcare. They had an entire half day, segment on AI innovations in healthcare, and they're making
Oh,
such great strides in care tools with
yeah.
AI and, like, you know, different ways that they can analyze things and being able to, like, access genomes and see, like, different areas where there can be conflicts with drugs or maybe drugs won't work as well because of their
Oh,
genetic
yeah.
makeup, and they're having all of these strides, and then it's like you go and look at and like you said, it's like dinosaurs with the insurance
I
and,
mean,
like,
they
the
still
billing.
use fax machines. It's like,
Yeah. It's like, what? Why? Like, what?
yeah.
You would think, like, one is way easier to automate than the other, so you would think that they would go for the easy one, but they're not. So, yeah, it's a really good point that you had there. So, how has your business model evolved, especially with changes like Medicaid regulations and shifting the reimbursement structures? Like, how do you evolve things and stay with the times as different requirements are changing?
Yeah, yeah, it's been a real roller coaster, so I'm glad you asked about that. With my background in international work, I have worked with a lot of refugees, immigrants, newcomers to the country, most of whom were covered by Medicaid. So a lot, and then I got certified as a community health work, and here in Rhode Island, we could actually bill Medicaid for our services.
Oh,
So a lot of
nice.
what I did was actually covered, which was really great. So for a while there, I was able to work with new arrivals, set them up with, an insurance plan, a primary care doctor, any medications or equipment that they needed. We would get them all set up, ready to go, and then make sure they knew how to get to the hospital, all those kinds of things. And it was all covered. And I was reimbursed for my time by the state, which was fantastic. So
Yeah.
that was really exciting. A lot of what I intended on doing when I initially started Wheelhouse was to serve that population
Mhm.
because I know, again, thinking through all of the hurdles that everyone has to go through, doing those with the additional barriers of being in a new country, not speaking the language, all of those other barriers that people face. That's
Right.
really what I wanted to help tackle was those additional barriers as well as the hurdles of navigation themselves. So last year whole the whole operation was essentially cut. So Medicaid was no longer reimbursed. The state no longer reimbursed community health workers. They added a ton more regulations in order to be paid by the state that I wasn't able to implement within my business. Unfortunately, they were out of the scope of what I could offer. I was no longer able to provide those service one on one and actually get
Mhm.
reimbursed that way. And then there were no more refugees arriving. So there were no more newcomers.
Yeah.
Not that the people here don't need help, but that process that I had of setting up new people definitely switched. So I had to pivot, and so I pivoted to all private pay. And so I am working with people who can afford an hourly rate to do consulting work for them,
Mhm.
basically. Like we spoke about earlier, taking on the authorization and taking the weight off your shoulder. So that is a consulting relationship that does have an hourly rate or a cost associated with it. And then I also have some subcontracts with actually organizations that can bill Medicare.
Mm.
And so Medicare covers patient advocacy, for people with again a lot of regulation. So I'm not able to implement that in my organization because you need to pay physicians to sign off on care plans, etc. But I have contracts with organizations that are doing that. So that's been a really great way to adjust. And then another thing that we're working on is developing more of an education arm to Wheelhouse. So if I can't provide the service for you, then my goal is to teach you, give you the tools to actually accomplish these navigation negotiations, et cetera, and navigate those barriers yourself. And
Mhm.
then, we'll be here as a backup if you get stuck.
That's great. Having kind of a DIY option for people is
Exactly.
a really smart business move because you're able to help people that maybe can't afford full service but still need the help, and you're able to offer it at a lower discounted rate. And it's nice too because you can automate that. I think that's a great strategy for any business that can do it and finds a spot for it. So super smart. That adaptability piece is definitely something that I think a lot of founders struggle with,
Yeah.
especially in healthcare adjacent spaces. And it sounds like you've done a really good job of pivoting when needed as the environment shifts.
Thank you.
For other founders or practitioners that are listening, what is one operational shift or mindset change that has really helped you move forward in your growth?
Oh, that's a great question. I work with an incredible mentor. So I one piece of advice is have a mentor in the first place because
Hmm.
I have this incredible network of people that are cheering me on at every step of the way. And I would have given up so many times without that.
Yeah.
So having mentors, I took advantage of a lot of different incubators, accelerator programs that teach the business side of things. And so that has been really, really valuable as well. And again, added them to my cheering corner, which has been really, really invaluable. I think too, a lot of people get imposter syndrome. And so like I said at the beginning, I have no medical background. Who am I to hustle a hospital for you and get your bill reduced by $100,000? But the thought is, if it's not me, then who?
Hmm.
If I don't put myself out there and offer these services, then it's possible that nobody would be doing that,
Hmm.
and that these people would be facing these life changing balances. And so, I do have the skills. I have proven that I have the skills. Have a track record of saving people thousands of dollars, and putting myself out there and offering this service is really it's almost like a requirement that I did it.
Right.
If I didn't do it, it would be doing a disservice to the population that could use me.
Yeah.
So that mentality was really, really crucial, getting over the kind of initial hurdles. Yeah, thinking of this as a side hobby, those kinds of things.
Right.
And it's like, no, this is a real practice and it's a real business that can truly change lives.
I think that's a great distinction that you just made because I feel like a lot of people go through that route where it's like you feel this imposter syndrome because you don't have the specific, letter in your name or the specific background that you feel is necessary. But a lot of times our other background or our life experience provides with so much more of a qualifying skill set to do what we're doing that we really are more than the right person for the job. 'Cause like you just said, 99% of people couldn't do what are doing and they don't have the experience to do what you're doing. So you're right where you need to do and helping people in the way that you need to help them. So I think that is a great distinction that you made in that mindset shift. Awesome.
Yes,
Thanks for sharing that.
of course.
So as we look, let's talk about the future here. As you look to the next 3 to 5 years, what changes do you see coming in healthcare navigation, patient advocacy, or access to care that practitioners should be paying attention to?
Great question. I think policy changes are coming at us left and right. So staying on top of what you're covered for, what you're paying for and what you should get for your money basically when it comes to insurance coverage. I think that that's going to be increasingly difficult. I've seen kind of a trend shifting from I got this bill, how do I pay for it, to I think I might get this bill, is there anything I can do proactively? And so that's been an interesting shift, and I think that'll continue for people who are kind of waking up to the fact that the healthcare system may not be as transparent as one would like.
Right.
and kind of trying to hold their feet to the fire before they even get the bill or the services rendered. So those two big shifts are, because, and I think that that comes from a lot of raising prices across the board. People are just
Hmm.
being more conscientious with where their money's going. Well, in terms of the industry, I think there's really interesting conversations going on within the patient advocacy industry because it's definitely still a new field.
Hmm.
We have, different players. There's a lot of different specializations out there, a lot of people that do different things. But there's a lot of discussion about increasing that insurance reimbursement, extending the Medicare reimbursement to potentially Medicaid and private pay insurance coverage or commercial insurance coverage. And so that would be really interesting. There's debates both ways, pros and cons, if that were to happen. And then I think the biggest question is, how do we, as a whole community of patient advocates, how do we provide those services to the people that can't afford our hourly rate? I think that
Hmm.
we have a mandate to figure out how to do that. And so as an industry, as a community, um, I think we should all be looking toward what can we do to rise all boats, as opposed to just the people who can pay our invoices. So that's definitely, it's definitely a huge conversation that's already ongoing. There's lots of really cool ideas out there, but I think it'll be interesting to see what really falls out of that.
Very well put. Yeah, I think those are great things to examine as we look to the future in healthcare. We have to figure out a way to take care of the people that are unable to afford
Yes,
services like yours because they're the ones that often need them the most.
exactly.
Yeah. So
And they're raising prices, the unnecessary care that they're getting because they don't know about how to navigate the system is raising prices across the board as well. So it's making
yeah.
all of our care and all of our coverage more expensive. So that's why, like, that's where the mandate comes from is, we need to be looking across the spectrum.
Yeah, and the more that people engage advocates such as yourself, the more transparency is being demanded from these
Yes,
organizations.
very
So I think
true.
it's super important, even especially at levels where you can afford it, to fight these things because the more people these agencies have to spend time going back and forth, the more it forces in the transparency that
Yes.
really needs to shift in the whole ecosystem,
My motto is the squeaky wheel gets the grease. So we need more squeaky wheels out there
which is
making
perfect.
people.
Your wheelhouse name. I love it.
Exactly. Kind of where I came from.
Yeah, that is awesome. I love that. Okay, cool. Well, before we wrap up, we're going to do the lightning round. These are some quick,
Oh boy.
short answers, super easy, just four questions. So I'll ask you a question and then you just say the first thing that comes to mind. And so, what is one myth about healthcare navigation that you would eliminate forever?
Don't pay the first bill.
What habit keeps you steady when stakes are high?
Mm, gardening, getting in the dirt.
I like that. Okay. What gives you the most hope right now?
The people I work with, they're just so grateful and so genuinely excited to have someone helping them, that it just really keeps me going.
It's wonderful. I love that. Okay, last one. Where can listeners follow your work and learn more about Wheelhouse Health Navigation?
Great question. The best way to get in touch is through the chat form on our website. And so that's wheelhouse-health.com, and fill out the chat form and ask, you can ask any questions. We can get back to you. And you can also schedule an appointment to meet with me. We're also very active on Instagram and LinkedIn, so follow us there as well. You'll see clips of this interview coming out soon, I'm sure.
And we'll include links to all of that in our show notes so that anyone who wants to take a look and take a click can do so. So Emily, thank you so much for being here. It's such an important conversation, and I know it's going to open a lot of eyes for both practitioners and patients. So thank you for your time. Appreciate having you on the show.
Thank you so much for inviting me. It's been
Of
great.
course. To our listeners, if you found today's episode valuable, please make sure to like and subscribe and share it with someone who needs to hear it. And if you're a practitioner, think about how services like Wheelhouse Health Navigation can support your patients beyond the clinical setting. Until next time, this is the Practice Pulse. Innovation creates possibility, implementation turns it into growth. We'll see you next time.